My name is Akshay Chhana. I'm a board-certified periodontist. Being a periodontist involves doing procedures to aid the tissues that surround the gums. So we have 3 different parts to our specialty, and that's kind of what I think makes it so special. One is we have obviously the implants, restoring missing teeth. We have the soft tissue proponent to it, making sure the tissues around the teeth are nice and healthy. And then we also have the disease component of that, and that's making sure to reducing the inflammation around the teeth, getting rid of severe gum disease or severe implant-related diseases. Like I said, when the disease gets to a point, we are able to replace the diseased teeth with implants and other prostheses like that. So my passion for dentistry, ever since I was a young kid, I've always wanted to be a doctor, but I got to college and I challenged myself to think about what kind of healthcare provider I wanted to be. Specifically with dentistry, I love that you could provide immediate care or see immediate results with your patients. But the thing that stood it out from all other healthcare professions, to me at least, was that I got to see my patients on a reoccurring basis. And that was my favorite part, because the bonds that I've formed with my patients, especially when I was shadowing and interning in college, is some things that I always look back upon, and I loved forming those memories. So I wanted to be able to see my patients on a recurring visit. That was my favorite part, is just the relationship aspect of it. One superpower, probably that initial, when we're first getting you numb. If I could just delete that part so you're automatically numb, that would be my favorite part. I think you're able to do a lot of amazing things with dentistry, but if I could just get rid of that one part or make that even a little bit more comfortable for you, that would be my superpower. Favorite Disney movie? Does Holes count as a Disney movie? Was that on Disney? Okay, it's not like a true Disney movie, but I loved Holes. Oh, 100% ice cream. I'm on like this calorie deficit thing, and I just look at the ice cream and I'm like, I can squeeze it in somewhere. Probably Dr. Singh's case. When he first came in, he was a little bit timid. The way it seems like he's lost a couple years. He's aged, reverse aged. He's got a little bit, looks like he's younger. And just things are just way more healthier in terms of his whole oral health. And so that's been a pretty awesome transformation, just to see him from when he was first coming to now. It's been cool to see that. One is it doesn't have to hurt. My goal for whatever I do with my patients is you should always be comfortable. In the first visit, I want you to be comfortable. During the procedure, I want you to be comfortable. There should be no point where you have to hurt. Even after the procedure, we can help you to be more comfortable. I always tell my patients that I don't want my procedure to look good immediately. Anyone can make a surgery look good a week after, 3 weeks after, but long-term success should be not just immediately after, but 5, 10, 15, 20 years. I don't care if you forget my name, but I want you to remember that doctor was able to make me feel really comfy, but most importantly, he taught me how to take care of my teeth. So my favorite time is spending it with my friends and family, whether we're playing pickleball, whether we're going to happy hour, whether we're going to one of the many good restaurants, specifically sushi. I'm a sushi addict.